is your question? Right, so if you are very understood considering the surgical anesthesia, kindly tell me how many compartments there are in the leg.
Ma'am, there are 4 compartments in the leg: the anterior compartment, the lateral compartment, and the superficial and deep posterior compartment.
Yes, what are the muscles in each compartment, and they are innervated by which nerves?
Then the anterior compartment contains the tibialis anterior muscle, the extensor hallucis longus, extensor digitorum longus, and the peroneus tertius muscle, supplied by the deep peroneal nerve. The lateral compartment has the peroneus longus and brevis muscle, supplied by the superficial peroneal nerve, and the posterior compartment, superficial, contains the gastrocnemius, soleus, and plantaris.
Yes.
Deep compartment contains tibialis posterior, popliteus, and the flexor hallucis and digitorum muscles, supplied by the tibial nerve.
Good. Okay, can you please tell me what are the structures which pass through the, this is the lateral malleolus. So if you can tell me the structures which pass behind the lateral malleolus, or is it the medial malleolus?
D is the lateral malleolus, structures passing
Yes.
through lateral, behind lateral peroneus longus muscle and brevis tendon, and sural nerve.
Okay, can you please tell me what is the dermatome of, where is the dermatome of S1? If you're asked.
S1. Yes, ma'am. S1 is on the lateral side of the foot.
Okay, can you please tell me the territory of supply of saphenous nerve? On the leg.
Sorry, ma'am, I couldn't hear you.
If you can explain the territory of supply of the saphenous nerve, where does it supply?
The saphenous nerve is consistent behind the medial malleus and supplies the medial and the inner aspect of the leg.
Good,
and
very good.
The thigh.
And what about the sural nerve?
Sural nerve supplies the posterior half of the leg, that is the shin supplying over the calf muscles and the lateral part of the sole and the foot.
Okay.
Yes.
If a patient has an open fracture like this patient has, and a patient is complaining of pain post-operatively, it was internal fixation and reduction was done. So how would you confirm if the patient has compartment syndrome?
In compartment syndrome, the pain is out of proportion,
Yes.
as well as if there is pain in passive dorsiflexion or active plantar flexion, then we can conclude that he might be suffering from compartment syndrome. As a matter of leg signs, there could be paralysis, pulselessness, and paresthesia.
Yes, and there are paleness as well. There are 5 P's.
Yes, 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 ma'am.
Can you tell me all?
Pale. Yes, ma'am. Pale, pulseless, paresthesia, paralysis, and one more is there.
One more.
Pain, paresthesia.
So you'll tell me that. Okay. What is the normal intra-interosseous pressure? How do you confirm, or how do you measure intra-interosseous pressure?
Transcutaneous pressure measurement devices there.
Okay. Can you please identify the structures in the right image? Which image is this and what is it showing?
And that is a digital subtraction angiogram of the popliteal artery.
Yes.
The labeling A is the popliteal artery, the labeling B is the anterior tibial artery, C is the posterior tibial artery, and D is the peroneal artery.
Good. Okay, can you please tell me how is it what is the best way to manage compartment syndrome?
Ma'am, if the
How many
patient has a
fasciotomies are
plaster,
done? Yes.
sorry ma'am?
Yes, you continue first and then my second question.
Yeah, if the patient has a plaster cast over his limb, then removal of the compression or the plaster is the first step. If the patient is suffering from compartment syndrome, then we should proceed ahead with the fasciotomy of the compartment.
Yes, how many fasciotomies are done to relieve the compartment syndrome?
Ma'am, if there is a compartment in the anterior side, then anterior lateral fasciotomy is done. If there is posterior, then posterior incision also taken.
Okay. Can you tell me if a patient has common peroneal nerve transection, how would the patient present?
Ma'am, the patient will have loss of eversion and dorsiflexion of the foot.
Yes.
And
And
there
numbness of the
there
dorsum
is
of the foot.
some say numbness on the dorsum of the foot,
Yes.
and also on the posterior side.
How would you confirm this foot drop from if there is a transection of sciatic nerve?
Ma'am, in the sciatic nerve, the muscular supply of the tibial nerve will also be affected. The
Yes.
plantar flexion will also be weak in those patients, ma'am.
Good.
And cutaneous nerve supply.
Yes. Can you please tell me how would you? Yes.
Yes, ma'am.
Can you please tell me how would you confirm the ankle reflex and which dermatome does it represent or covers?
For the ankle reflex, the ankle is the foot is kept in pointed laterally, flexed, relaxed, and the hammer is used on the Achilles tendon, while the leg is exposed completely to look for reflex on the calf muscles, ma'am. And the dermatome involved is S1.
S1. Okay, how S1 is tested? The lateral aspect of the foot. Okay.
Yes, ma'am, the lateral.
If you have to confirm the movement of external hallucis longus muscle on a human model, how would you do it?
Extension of the toe, as it also helps in eversion and dorsiflexion of the foot.
Good. What is the nerve supply of extensor hallucis longus?
Deep peroneal nerve.
Okay, good. Right. What are the vessels they are found deep to external hallucis longus muscle?
Tibialis anterior artery and vein are found deep to this muscle.
Okay. Right. If you are asked to demonstrate on a subject tibialis anterior muscle, how would you point it out or how would you identify it?
Muscle on the anterior, which passes from the lateral side of the tibia to the first metatarsal and the medial cuneiform bone.
Yes. If you can tell me how would you orient and articulate tibia and fibula? So how many joints there are present in between these two bones?
Ma'am, proximally the apex of the fibula articulates with the lateral condyle of the tibia,
Yes.
and distally there is articulation between the lateral malleolus. I don't know. I'll get back to you with that.
Okay, good. Thank
And there is a interosseous membrane between the tibia and
Yes.
tibula bone.
So how many joints would that be in between?
Three joints.
Good, good. Good. Started